Like what Ms. Joanne mentioned, I am Juan Miguel Veyra, a research associate at PMAP, and I will be your segment host for Must, where the events and current affairs that you simply cannot miss are in the spotlight. And for our Must this month, in celebration of Mental Health Month, we give importance to the mental health wellness of our viewers. Now, to join us in talking about My Wellness is My Uniqueness, we have the founder of PsychConsult, Dr. Arsenio S. Alianan Jr., PhD in licensed and registered psychologist. Welcome to our segment, Dr. Alianan. Good afternoon, Dr. Boboy.
Hello, Migs. Good afternoon. It's such a pleasure to be here today.
Okay, sir. You can start off by kindly introducing yourself to our viewers
Oh,
for this afternoon.
yes. I am Boboy Alianan, and I am a psychologist, no, a clinical psychologist, in fact. No, I've been practicing psychology for almost 30 years now, and I mainly practice at PsychConsult Incorporated in Quezon City. But I'm also a full-time faculty member, associate professor at the Department of Psychology in Ateneo de Manila University.
Mhm. Okay, so let's dive right in, sir. So can you tell us a little background on PsychConsult? Like what urged you to establish it, and how did it start?
Oh, in the late 90s, I used to practice independently together with a couple of colleagues, no? And, we shared the rent. We were practicing in a small apartment unit in office unit in Green Hills. And pretty soon, a number of people who wanted to become psychologists wanted to train under us. No, so they would come, and we would train them, and we would expose them to the work we were doing. And after a while, we sort of like thought maybe we should band together and become one entity, no, and create perhaps the first group practice for psychology in the Philippines. And that's how PsychConsult was born. So we've been around since 2001. So we're actually celebrating our 21st year today, this year.
Oh, happy anniversary to PsychConsult, sir. Truly, truly very
Thank you.
relevant in our country today. So, with that, on that note, should modern HR develop a mental health program, given the current setting of most workspaces in the country today? Should modern HR develop a specific mental health program for employees, and why is that?
This is a very good question. Thank you for asking that, Migs. No, nowadays it is highly acknowledged, no, that well-being, mental health, no, are integral elements of health, and this is part of the definition of the WHO of what health constitutes. No? And then here in the Philippines, we have adopted this definition as a member state, of course, of the WHO, and in response to that, our own government had put together the Mental Health Act, no, in 2018, and up to this time, we're really slowly implementing the various provisions of that law. Now, the most important part, of course, of this is that the awareness of mental health and the integral part of mental health in health in general, but also, of course, in productivity and work. So if companies pay attention to the health of their employees, it is but natural that they should also be including the mental health of their employees.
Yes, sir. I totally agree with you. Just like how we give importance to the physical health of our employees, we should be able to give importance as well to the mental health and well-being of our employees. So, on a workplace setup, Doc, how can we identify or spot an employee who needs help with their mental health? And what's the best measure that we can implement or carry out in addressing such situations?
I think there are several levels that we can be thinking about how this very good question can be answered. No, on I think one very basic aspect would be on a policy level, right? higher management needs to acknowledge that mental health indeed is part of health, and so we'll need to create provisions for employees to actually take mental health leaves, no, and also to acknowledge that there is a need to address mental health conditions and mental health issues, no, and this can be formalized by including perhaps mental health services into, let's say, the health packages that are offered to employees, no. So these are very basic provisions that we can ensure that a company really pays attention to the mental health of their employees. Now, another aspect of this, of course, is the approach, no? The approach of, let's say, managers, HR included, no? Towards their employees, no? There is a reality that we need to confront of the stigma of mental illness or mental health conditions, no, and there is many people do not understand it, and with the lack of understanding of mental health conditions, of course, come suspicion or even outright denial of such conditions existing, no? And there are also the general parang sweeping under the carpet because it's invisible. It's not something that is clearly seen, no? And in fact, sometimes it is an invisible killer, no? When for instance, a person who is severely depressed decides to end their lives, and people don't even see that, no? A person, for instance, just decides to end their lives, and people wonder, how did that happen when this person was just coming to work and doing their work, but they tended to be alone. They didn't want to mingle too much with people, but they seemed okay, no? So it's so easy to deny this. It's so easy to stigmatize it, no? It's so easy to minimize it, no? So I think the first step here, of course, is awareness that this is real. It really happens, it exists, and it affects people's lives, no? And then after that awareness happens, of course, the approach, no? And I mentioned this earlier, we need to approach employees with care, no? With care. And it's not just, output, no? You have to give me what I need, right? It's also respecting what the person is able to give at that time and where they are in their lives, no? So for me, it's very, very important that we are sensitive to the needs of our employees, no? And that we are able to offer, if it is available, of course, in their health packages, to offer the services that could benefit them, free of stigma, no? That they are not stigmatized, or they don't have a red mark on their folders or their names because they went to see a mental health practitioner, no? So these are some of the things I think that we need to be addressing, we need to be doing as a way of really catering to the mental health of our employees.
Yes, I totally agree with you, Doc. I mean, breaking the stigma and the prolonged chain that has surrounded mental health in the Philippines starts with awareness and education. And I totally agree with you, Doc, that it should be normalized even in workspaces. So we have a question, Doc, from Miss Rhea Roses Gadi from our Facebook page. Is mental health different from well-being? What aspects should employers focus on?
Mental health and well-being are synonymous. They are one and the same, no? When a person experiences good mental health, they feel well. No? But I think well-being is a much larger concept, because well-being, of course, includes physical health as well, right? That you feel well, you feel healthy, that everything is going well in your life.
Okay. I hope, Miss Rhea, that answered your question. So for our last question, Doc, we have here, what are the best HR practices that you can suggest for HR practitioners that are listening to us right now to in order to promote a healthier work environment in their respective industries and companies?
I think it's very, very important that HR departments um, take a keen interest in promoting mental health in their companies. No, so it's really creating well-being programs. No? I know many companies, they actually do this already. They have yoga for lunch. They have talks on mental health on certain times. They have exercise programs, diba? But maybe over and above these general health programs, we can also include, tackling very common issues among, let's say, employees in the company, given their profile, given what might be at risk in the industry that they are, or given the kind of work culture they have, that there is a kind of enabling of protective factors. No? What are these protective factors? What are the things that we could be asking HR to be promoting? No? They could be promoting various kinds of skills that employees can use to help themselves. No? Well, first, of course, being aware if they need anything, to be able to access the help that they need. No?
Services.
And two, of course, being able to mobilize certain skills, no, problem solving skills, being able to mobilize certain self help skills that could help them in promoting their own mental health. No? But on top of this, of course, to also be able to identify by maybe through screening that is included in the annual physical exams, no, mental health as well. And if there are risks to mental health issues, that they are also referred to appropriate professionals, no, so that these are addressed. No? And we need to offer, of course, as always, because of the data privacy, no, confidentiality in all these services. No? So these are very, very important elements that we need to be paying attention to when we are in HR.
Yes, truly, Doc. The introduction and an establishment of a healthy working environment promotes good mental health for our employees. Thank you very much, Dr. Boboy, for that very informative talk. And I hope our viewers learned so much from our 15-minute segment for today. Back to you, Miss Joanne.